Namaste all. Today, as a part of Dhanvantari Jayanti week, we are having an online webinar on the topic lifestyle and wellness through Ayurveda. Myself, Dr. JISHNU S, working as Special Medical Officer at AVCRI, Coimbatore. I'm just directly going to the topic Ayurveda, the basics. So Ayurveda is the knowledge of life. It is formed of two words, it's Ayur and Veda. Ayur means life and Veda means knowledge. So the basic concept of Ayurveda is based on three doshas, as we all know, the Vata, Pitta and Kapha. So according to Ayurveda, the body is comprised of this unique combination of these three doshas as their constitution, which determines their physical and mental characteristics. When it comes to the pathology, these three doshas, that means this Vata, Pitta, and Kapha, determines the pathology of the disease also. How the balance of these three doshas varies, depending on that, disease will be manifested on the body. So always the balance is the key in treating a disease also, and also for maintaining the good health. Means the balance of these three doshas. The illness arises when your doshas are out of balance. Ayurvedic practices, including diet, exercises, and daily routine, helps to restore and maintain this balance. So, what is the key of health according to Ayurveda? So, according to Ayurveda, there are lot of daily routines or seasonal regimens to be followed to maintain the balance of these three doshas. So the first among this is the dinacharya, that is following a constant daily routine. And the second one is following a seasonal regimens. It is called Ritucharya according to Ayurveda. And the third one is eating a balanced diet tailored to your body needs, because each our body is different and the constitution is also different according to the doshic constitution, as we already discussed that based on the balance of this Vata, Pitta and Kapha, the constitution will be different. So taking a balanced diet based on which suit to our body constitution will helps to maintain the good health and wellness. So incorporating mind and body practices like yoga and meditation. So along with this physical health or physical well-being, mental health is also important. Nowadays, see, a lot of people are struggling with work stress, family stress, and a lot of other such kind of issues. And so the mental health is always a topic of discussion or a major concern in today's society. So doing proper yoga and meditation to maintain a good mental and spiritual health is also important to have it's important in that it's a key in maintaining that health according to Ayurveda. So we will see one by one that Ayurvedic lifestyle practices, daily Ayurvedic lifestyle practices, that is called as dinacharya, following a daily routine. That is a key in Ayurvedic wellness to maintain health and prevent diseases. From morning to evening, according to Ayurveda Samhitas, a lot of practices are being told. That's in this area of dinacharya, like waking up early in the morning, especially in the Brahma Muhurta, rising before sunrise, ideally between 4 a.m. and 6 a.m. is recommended for mental clarity. So a lot of studies are also showing that this period, this early morning period, in this period, actually, the brain will be in very active state and will be having more clarity in for thinking or will be more creative in that period. So waking up early in the morning makes the body makes the day more fresh and productive. Then eliminate your natural urges. Listen to your body and attend to the natural urges of elimination. So our daily bowel cleaning and this such kind of that passing the urine, clearing the bowels to and that kind of natural urges should be eliminated as part of the daily routine to keep the body clean. Then oral hygiene, so that we always do the brush your teeth, scrape your tongue, and perform oil pulling, called Gandusha, according to Ayurveda. So that will help to maintain a good oral health. For this brushing and all, Ayurveda prescribes a lot of herbal brushes kind of thing. And today in market, there are a lot of herbal powders are also available for doing the brushing kind of thing, and doing the proper scraping of tongue to activate your taste buds and perform the oil pulling, gandusha kind of things will help to maintain a healthy teeth and gums. And for the cleaning purpose of the oral cavity also it helps. And while doing the oil pulling, you should be very conscious about using the oil, either it should be plain sesame oil, or we have specially prepared oils like Arimedas Thailam, so which is good for maintaining the oral health. Then morning practices like herbal oil massage called Abhyanga. A self massage with warm herbal oil nourishes the skin, calms the nervous system, and improves the circulation. So herbal oil application means you need not to have a massage session every day, as it's not practically possible also, but at least self oil application to the body just before the bath will always helps to improve the circulation, keeps the muscles, the flexibility of the muscle will be improved, and the joint strength will also be improved by doing a proper self oil massage with either a medicated oil or even plain oil, Tila means the sesame oil, or medicated coconut oil will be sufficient for doing this self oil massage. Then exercise, vyayama. So nowadays, most of the people are not having adequate time to have a proper exercise, or I don't have the time to reserve for proper exercise. So engage in light physical environment movements like walking and yoga. Exercise should be done about 50% of your capacity and should not be exhaustive. This point is very important, because today in our OPDs, a lot of patients like above 50s or 60s, they are coming and telling, so I'm not able to jog this much of distance kind of thing. So body's not able to body is not cooperating for doing this much of jogging to this much of distance. I was able to do it 3 years back or 2 years back. So always we should understand that every body is not the same. So always depends on your body condition, on body fitness, your exercise should be designed, and it's not the same for everyone. You cannot have a same kind of exercise pattern to everyone, to every age kind of thing. So you should know how much in what extent your body is capable to withstand the exercise, and it should be done according to the half your strength. That is the thing which is referred in Ayurveda. Artha Shaktiya Vyayama. So that the Vyayama should be done half of your capacity. Then Nasya, daily nasal oil droppings, especially with Anutaila kind of thing. That's a medicated oil which is commonly prescribed. It need not to be done in daily basis. You can do it once or twice in a week kind of thing to have the nasal channels be opened. And those who are having the frequent sinus kind of things, or like migraine kind of thing, this Nasya procedures will be very helpful. And you should opt the oils accordingly. In for the all the disease conditions, same oil will not be sufficient. So you can consult a doctor and decide with which oil you should do the masya. So anyway, so it will help to improve the to open up the nasal channels and clear up the areas to so that will prevent from a lot of diseases. And Anjana, there is a herbal collyriums. Today also a lot of that collyriums are available in the market, but you can even prepare or in home, or you can procure some very good herbal collyriums in the market that you can apply on like daily basis or once or twice in a week kind of. So meditation and pranayama. So that's what I told in the initially. So today a lot of people are having with this work stress or family stress kind of thing, and the mental health is one of the major thing in discussion or in concern for the especially for the working population and all. So practice mindful breathing exercise and meditation to calm mind and reduce the stress. You need not to do a very like speedy breathing exercise or meditation kind of thing. You can even practice a very simple way of simple deep breathe in and breathe out, and just meditate for a few minutes, at least 5 to 10 minutes will be sufficient for on a regular basis. I always say 30 to 40 minutes of brisk walking plus 10 minutes of meditation and pranayama will be more than enough for maintaining a good like physical and mental health or well-being. So then for the daily practice, the evening, we have already discussed the morning practices, the evening practices, what are the regimens to be followed. So how the dinner should be taken. Eat a light dinner, ideally before 8 to 9 p.m. and allow for proper digestion before sleep. So that's, we always say to have a dinner at least 2 to 3 hours early than we go to the bed. If you're planning, we are all, scheduling the sleep by 10 o'clock or something, just always better to finish the dinner within 7 to 8 and have an adequate gap for the food to get properly digested. Can have a very light walk after the dinner. So take a short walk after the food so that it aids in proper circulation, and then the digestion will be also boosted up. Then proper relaxation, avoid screens and mentally stimulating activities before bed. So currently a lot of patients are coming with sleeplessness. So for the most of them, I tell them to avoid the screen time, especially after the dinner. Because after the dinner, when you are involved in like you are using the screen or you are watching so much of contents, definitely your brain will be active, and that will not see if you're diverting that same thing to some reading kind of thing, there is always chance of get eye and our brain get a little bit exhausted, and you will get a good sleep easily. So avoid the screens and very mentally active stimulating activities after dinner or before going to bed is a very good relaxation method that will aid to a good sleep also. So go to bed early. So aim to be in bed by 10 p.m. Sorry, 10 p.m. to support the body's natural cleansing processes. So that circadian rhythm and the body, the daily routine will be more streamlined when we have at least 6 to 8 hours of sleep from at least 10 to 5 in the night. The dietary guidelines for the daily basis that we can generally advise is eat for your dosha. Ideally, identify your constitution and choose the best food for you. So identifying the constitution, you always need a professional support, always like from an Ayurveda doctor or something. As I told, the body constitution will be either with the sometimes the Vata predominance will be there, sometimes Pitta predominance will be there, sometimes Kapha predominance will be there, and the mixing of these doshas will be always be there in the constitution. So you just identify which dosha is predominant in your constitution, and you can choose the food according to that. For example, those who are having Pitta Prakriti, they will be having always high chance of getting gastric distresses, and they'll be very prone to skin diseases kind of thing. So in those people, the food which vitiate the pitta should be reduced, or in the daily food, that kind of food should be avoided, like very oily, very spicy kind of thing. So those who are of pitta prakriti and taking continuously spicy food, definitely they will be having chance of developing acidity kind of thing, or sometimes it may be exhibited at different kind of inflammatory skin conditions, or sometimes like maybe in long run, sometimes arthritis or inflammatory arthritis kind of thing. So identify your constitution and design a daily food pattern according to that is very important according to Ayurveda. Then include all the shad rasas in our diet. Include all the six tastes like sweet, sour, salt, pungent, bitter, and astringent in your diet. So that will keep a balance of the doshas, and also it's always about the balancing of the diet, that make it in a very not very spicy, or not very not going to the extremes. So keep a balance of this all the rasas in the body. So then practice of mindful eating. Eat in a very calm environment without distractions. Chew your food slowly and fully to support digestion. So it's always important to have very calm atmosphere when you're taking food. As we all know, when we are taking food in a very urges, or in very tension or kind of thing, or in a atmosphere which is little bit stressful, definitely that will always sometimes hamper our digestion kind of thing. And so always keeping a having a peace atmosphere while taking the food is very important. Then seasonal eating. Eat food that are fresh and in season. This aligns your body with nature's cycle and support natural balances. Means in different, we have six ritus in our calendar. So in each ritu, we'll be having some fruits or some like vegetables will be more available in that season. So take that seasonal food is very important. Nowadays, we know, for the fruits and vegetables, due to with like preservatives or like chemical additives, it is being preserved all the year. So that is currently with the market demand, that is possible. But when we are more stick on to seasonal foods, we can like little bit stick away from our, like, and can be little bit away from that kind of like heavily preserved or like chemically preserved foods. So that is told in Ayurveda in very olden period itself, to have a seasonal food that will align your body with your nature's cycle. Then mental and spiritual wellness. Yoga. Practice yoga, including loosening exercises, asanas, and relaxation postures to improve physical and mental balance. While doing the asanas, kind of in yoga asanas, always take a professional support, because currently from 30s itself, a lot of people are developing neck pain, low back pain kind of thing, and the spine is getting degenerated from the early ages itself. So when we do very strenuous exercises or asanas without any medical guidance, sometimes it will deteriorate, or it will worsen these degenerative conditions. And when we stress up some like bones or some areas, that will always leads to other further complications, like especially in this spondylosis or lumbar or cervical spondylosis, and sometimes in this intervertebral disc prolapse kind of thing, excess pressure to the spine kind of thing is very dangerous. So take always a proper guidance of medical guidance while doing this yoga. No. And pranayama and meditation, dedicate time for simple breathing exercise and meditation to calm your mind and achieve inner peace. So that, as I told initially, should have reserve at least a very like 10 to 15 minutes is enough to do a very simple breathing exercise. It's like very speedy breathing kind of thing is all. It's not much needed actually. Very slow breathe in and breathe out exercises to that will improve the brain capacity also, and also improve the oxygen supply to the brain also. So we can practice at least 10 to 15 minutes of simple pranayama and meditation techniques. Meditation is simply just focus in particular area, and that you can close your eye and just concentrate in particular area, and just concentrate on your breath in few minutes. That's more than enough. So that will improve your mental clarity, improve the like supply to your oxygen supply to the brain also, and will have a see, there you will have the proper effect of this meditation. Then stress management. Keep your mind and senses satisfied through mindful activities and moderation. So this self-management is always a self-control thing. So should keep away from very like toxic atmospheres and keep your mind engaging in what you love. That will always help to manage the stress. And along with that, you can, if you're see currently this work stress or family stress kind of thing is a very major concern, proper pranayama or meditation techniques will also be helpful in managing the stress. Then personalization. Recognize your unique constitution and tailor your diet and lifestyle to your individuals. As I already told, you can take a professional help to identify your proper constitution, and then design your lifestyle and food according to that. If you are Vata predominant, you are Pitta predominant, you are Kapha predominant, your body will be having that kind of that qualities will be of that particular dosha. This dosha is basically it's a accumulation of qualities. It's being categorized based on that. So we have Vata dosha, as particular qualities will be more predominant in your body. When you are Pitta dosha, that kind of qualities will be more predominant. When you are Kapha dosha, that kind of qualities will be predominant in the body. So decide your constitution and design your diet and lifestyle according to that is very important. So, and for a general for a general awareness, these are the 8 branches of Ayurveda. It is called Ashtangas of Ayurveda. You can just go through it. Kaya Chikilsa, Bala Chikilsa, Graha Chikilsa, Urdhvanga Chikilsa, Shalya Chikilsa, Visha Chikilsa, Jara Chikilsa, and Vrisha Chikilsa. This Kaya Chikilsa is, we can be correlated to the general medicine in modern medicine. So which deals with all the like neurological diseases or all the infectious diseases kind of things are being taught in this Kaya Chikilsa, general medicine. So then Bala Chikilsa deals with the pediatrics. Then Graha Chikilsa deals with the psychiatry part. And Urdhvanga Chikilsa deals with both ophthalmology and ENT. That diseases and its treatments are being taught in that area. Shalya Chikilsa deals with the parasurgical and Marma Chikilsa also, treatment of Marma Chikilsa. Very, as you know, that Sushrita is a very well-known acharya in this Shalya Chikilsa surgery part. So currently also a lot of parasurgical procedures and surgical procedures are being done in hospitals, Ayurveda hospitals. And the Marma Chikilsa also, 107 Marmas are told in Ayurveda. So that's our the energy points in the body, the manipulating or streamlining the energy points will always be, it's always helpful in Ayurveda for the pain management or like relaxing the body or loosening the muscles kind of thing. So that Marma Chikilsa is also a specialized area according to Ayurveda. And Vishwa Chikitsa, toxicology is a very vast area inside Ayurveda. And currently, this skin and this cosmetic part also that comes in this area, that specialization also comes in that area. Then Jara Chikitsa deals with the Rasayana Chikitsa. It modern we can correlate with the geriatrics kind of thing also in this Jara Chikitsa. And it's a Rasayana Chikitsa, it's a rejuvenation treatment. So in Ayurveda, and after that treating the disease, you should do Rasayana therapies to stabilize the immune system to avoid the reoccurrence of the disease kind of thing. So that all part comes in the Rasayana Chikitsa. And Vishwa Chikitsa deals with the infertility or aphrodisiac treatments in Ayurveda. So these are the 8 branches according to Ayurveda. So in a practical way, in an hospital setup, we can see 2 types of treatments. One is outpatient-based treatments in Ayurveda hospital, and second is inpatient IP-based treatment. That's the inpatient treatments. So these are the current in hospital setup, the areas of service we are providing in our hospitals. So in Ayurveda treatments, what are the medicines what we give internally? You may have heard about these terms and medications. Most of you have already been using this kind of medicines, kashayams or decoctions, arishtams or fermented decoctions, churnams or powders, medicated powders, then tablets, that's called gulikas, then medicated ghees or as ghee itself or sometimes as capsules, medicated oils as oils or capsule for external and for internal use. Then rasa aushadhis, they are purified herbo-mineral combinations are also being used in Ayurveda as internal medicines. So actually, in Tamil Nadu, you see the Siddha Vaidya, actually, this rasa chikitsa is more focused in the Siddha Vaidya tradition. If you are saying that, just go through the external treatments, what we generally does in Ayurveda, like you may have heard about these terms also, Abhyanga or oil massages, Udvartanam, powder massages, Pidicil or oil pouring, means pouring of oil or in locally, either locally or full body. It's called, we call it spiritual oil, Taila, dhar or Pidicil is told for the term is like that. Then kiri or ottalam or potli, a different kind of potlis are being used in Ayurveda, like podi kiri, enna kiri, navara kiri, etc. And a different fermented cereal decoctions like dhanya amla dhara. That's being mostly used in different kind of inflammatory arthritis kind of thing where there is severe swelling kind of thing is there. And different lay pumps or paste applications to sometimes reduce the swelling kind of thing. It can be done for the pacifying the dosha and sometimes to for improving the skin complexion kind of thing, like varnya kind of thing also. So labor the difference happens according to for what purpose it is being used, and different parasurgical procedures like Agni Karma, Kshara Karma, etc. are also done in Ayurveda as external therapies. These are just for the general awareness. So, Panchakarma treatments in Ayurveda. So, in the previous slide, just we have seen a lot of external procedures like Abhyanga, Udvartana, Pedichil, Kiri, or Dhanyam, Ladara, Lepanas, etc. So, most of the times, people is having a misunderstanding that these external therapies are the Panchakarma treatments. When we see the boards of the Ayurveda hospitals, we see the Ayurveda Panchakarma treatments available, and this oil pouring kind of thing will be exhibited there also. So a lot of people having a misconception that these are the Panchakarma treatments. Actually, these treatments like the Abhyanga or Udvatana or the Dhanyamla Dhara kind of thing are all actually the Purva Karmas. Purva Karmas, the preparatory therapies before doing the Panchakarma. Actually, the Panchakarmas are 5 cleansing therapies. They are Vamana, that is a vomiting therapy, Virejana, that is a purgation therapy, Vasti, that is the medicated enema, Rakta Mokshana, that is a bloodletting, and fifth is Nasya, that is the nasal dropping. So these are the 5 cleansing therapies that is intended to detoxify the body and also modulating your immune system to fight against the diseases and also for the general well-being or wellness also. So all other treatments what I have mentioned in the previous slide is actually the preparatory therapy for doing this 5 cleansing procedure. So so a lot of people will ask when they getting admitted for 5 to 10 days or 15 days, they'll ask whether we will be able to do all the panchakarmas together. So actually it's not possible because in that period actually any one of the panchakarma will be done in a period of 14 days or 15 days because there's a prescribed gap between this even the panchakarma procedures. In what gap after a vamanam virejanam should be done, after virejanam in what gap the basti should be done. It's all prescribed in our science. So we cannot do all the panchakarma together in a short period in a patient also. So the doctor have to decide which panchakarma suit for that condition or to that patient, to that particular condition, which panchakarma is suiting. That panchakarma will be done. And the other therapies like the preparatory or then the post strengthening therapies will be done, designed according to the disease condition and the body condition. So what are the benefits of this panchakarma? So I've told you what are the 5 panchakarmas. Doing the panchakarma according to your body or disease condition. These are the benefits. The toxins are being eliminated from the body. The doshas, the vada, the pitta and kapha are getting balanced with this proper panchakarma techniques. That stress is reduced and the body gets relaxed, slows aging process and increase the lifespan. When the proper cleansing is happening, that will help the body to rejuvenate by its own, to help to modulate the immune system to fight against the diseases, and that will help to slow down your aging process and increases the lifespan. It increases the glow and luster of your skin when the proper cleansing is happening. That boosts body immunity and body energy levels after doing the proper panchakarma treatments, and that enhances the strength, energy, vitality, and mental clarity also. So these are the benefits of doing proper scientific panchakarma treatments. So what are the do's and don'ts? Well, generally what we prescribe during the Ayurveda treatments. So a lot of people are very concerned about the pathyam that is to be followed during the Ayurveda treatments. So the do's that we generally prescribe during the treatment is called pathyam. And the don'ts that you are not supposed to do during the Ayurvedic treatment is called apathyam. So we'll see one by one what are to be followed and what are not to be followed during an Ayurveda treatment. Generally, the do's during the Ayurveda treatment. So these are the general advices what we give regarding the diet during the treatment. So we should be eat very light food, very especially steamed kind of food that will stream up or smoothen your digestion process. Take very warm and freshly prepared meals. It's not just for the during a treatment purpose only. You can follow it for long run for the general health also. Take warm and very freshly prepared meals. You can take organic and seasonal foods. Hydration. Body should take drink warm water or medicated water and room temperature water. So generally this we advise a patient during the treatment procedures, because while doing the external treatments kind of thing, it will be little body. Most of the treatment therapies are hot in nature and little bit dehydrating also. So a proper hydration of the body, keeping the water sip by sip is very important in keeping the body hydrated and to avoid the tiredness or fatigueness that happens during the treatment process. You can try relaxation techniques like breathing exercises like pranayama, meditation, and hearing music during the process. And what are the don'ts we tell during the treatment process is avoid drinks kind of thing, avoid cold drinks, coffee, alcohol, and caffeinated beverages that makes the body more acidic. So a lot of people ask whether we can take coffee daily on daily basis while taking the Ayurveda treatments. Actually, coffee is more acidic than if you're comparing tea and coffee. Coffee is more acidic in nature. So generally that's why it's a stimulant also. So it will generally a little bit increase the body heat also. So we'll always say to reduce the use of or avoid the use of these cold drinks, coffee, or alcohol, or caffeinated beverages during the course of treatment. Then avoid heavy foods that takes more time to digest. This is also a very common question that we get during the treatment course, and even during the first OP consultation for taking the Ayurveda medicine, whether we can take non-veg kind of thing during the Ayurveda treatment. Actually, it's not about vegetarian or non-vegetarian. See, when we take a non-vegetarian meal, definitely it takes more time to digest. Like when we take a chicken biryani, definitely you will not be able to, for the lunch, definitely you will not be able to take a full dinner, right? Because that takes more time to digest. So generally, all this Ayurveda medicines works by after proper digestion and assimilation. So when you take a very heavy meal, like non-veg kind of thing, regular basis, definitely the digestion will be little hampered and the medicine action will be slowed down. So that's why we always tell to take very light food during which is easy to digest during the treatment process. Take very less oily, less spicy, and less gassy foods. Generally, it's advised during the treatment process. Avoid processed foods and junk foods and raw and cold food also. And regarding this raw foods, also during the course of admission, also a lot of people ask whether we can take a salads kind of thing. So technically, raw foods are harder to digest than cooked foods because our system is designed in that way. Our system it's not built on a day, right? So it's came through a process of evolution, and it is mostly designed to digest more of cooked or semi-cooked foods. For this reason, Ayurveda generally favors well-cooked or lightly spiced veggies over raw salads. So raw salads, most of the part will not be properly digested, and that body is not having the power to digest most of the fibers and cellulose which is present in the raw food. So always our body is prepared for digesting the cooked or semi-cooked food. So we advise in that level. So that are the general thing that we in general advices that we can give for a general well-being, and that diet restrictions or diet and restrictions for during the Ayurveda doing the Ayurveda treatment. So we are concluding, and we are just giving a brief of our hospital, the Ayurveda Chikitsalayam and Research Institute, AVCRI Coimbatore. So this AVCRI Coimbatore is an Ayurveda Hospital and Research Institute located in Ramanathapuram, Coimbatore, with 75 years of expertise. It was established as the clinical wing under the renowned AVP group of institutions, Ayurveda Pharmacy Coimbatore Limited. That hospital was established in 1950, and the AVP itself was formed in 1943. Our institution is equipped with an expert team of doctors, therapists, and paramedical staff dedicated to delivering Ayurvedic treatments and clinical services at the highest standards and of quality and care. So these are the spectrum of diseases we generally manage at AVCRI Coimbatore. We're having experts, doctors in these areas like arthritis management, musculoskeletal disease management, spine disease management, neurodegenerative disease management, post-stroke management, skin diseases like psoriasis, eczema kind of thing, respiratory and pulmonary disease management, gastroenterology disease management, gynecological disease management. We are also having a specialized unit called Stree Raksha that deals with the exclusively gynecological conditions, and that also deal with the prenatal and postnatal care. Pediatric medicine also, we are having a unit. Psychiatric medicine, we are currently having a very new specialty unit called Manasa, which deals exclusively with psychiatric cases. Geriatric medicine, we are having expert doctors here. And Ayurveda cosmetology, we are having a specialized clinic called AVCRI, which is we started in 2023. So which is exclusively for Ayurveda cosmetology. So that's it. So hope the presentation was helpful, and you can, if you have any queries regarding your disease condition or your need any lifestyle advices kind of thing, you can mail us inquiries at doctors@avcri.com. And if any consultation of doctors and for this general health and wellness advices, you can call us and book appointment to this contact number. Thank you. Thanks a lot.